Hi everyone, welcome back to my YouTube channel, and today we are going to talk about anatomical planes. And here at the side you can see the diagrammatic representation of anatomical plane for the reference. So let's start the video with introduction. Anatomical planes are essential for describing locations and movements of different body parts. These imaginary surfaces help in understanding how to slice the body into consistent sections, which is especially useful in medical imaging, surgical procedures, and anatomical studies. Now let's talk about types of anatomical plane. They include sagittal plane, frontal plane, and transverse plane. There are three main types of anatomical plane, and one plane we have is oblique plane, that is also called as accessory anatomical plane. Now let's talk about these planes one by one. First we have a sagittal plane. Definition. Sagittal plane is a vertical plane that runs from front to back, dividing the body into right and left portions. It has two types. The first is mid-sagittal plane or median plane, and second type is parasagittal plane. Mid-sagittal plane can define as this is the specific sagittal plane that runs exactly along the midline of body, creating equal right and left halves of body. The other type of sagittal plane is parasagittal plane, that is any sagittal plane that does not run along the midline and results in unequal right and left portions. Further talking about sagittal plane, let's talk about anatomical importance of sagittal plane. This plane is crucial when describing bilateral symmetry, identifying medial versus lateral structures, and explaining movements such as flexion and extension. Now talk about medical applications. Sagittal sections are commonly seen in MRI and CT scans of the head, spine, and pelvis. Neurosurgeons use this plane to locate and operate on midline brain structure. Now let's talk about frontal plane. It can be defined as frontal plane divides the body into anterior and posterior portion. The plane that divides the body into front and back portion is called as frontal plane. It runs vertically but is oriented side to side. Now let's talk about anatomical importance. It helps describe features located towards the front or back of body. Movement in this plane often involve abduction and adduction, that is moving limbs away from the body and moving limbs towards the body. Now let's talk about medical application. Frontal planes are especially useful in chest radiograph, X-rays showing the heart, lungs and ribs. Orthopedic surgeons utilize coronal views to assess spinal curvature and joint alignments. Now let's talk about transverse plane, that is third anatomical plane or third main anatomical plane. As you can see here in the diagram, it can be defined as a plane that runs horizontally across the body and divides it into superior or inferior parts. It is perpendicular to both sagittal and frontal plane. As sagittal and frontal plane both were in vertical plane, but this plane, that is transverse plane, it is in the horizontal plane, and it divides the body into upper and lower parts. Talking about its anatomical importance, it offers a slice view of the body, allowing clear observation of cross-sectional anatomy. Movements such as rotation often occur within this plane. Talking about its medical application, transverse imaging is frequently employed in CT scan and MRIs, particularly for the brain, abdomen, and pelvis. Surgeons rely on this view for planning laparoscopic and robotic assisted procedures. Now let's talk about oblique plane, that is also called as accessory anatomical plane. It can define as the oblique plane is any plane that passes through the body at any angle that does not follow the standard sagittal, frontal or transverse orientation is basically the oblique plane. Talking about its anatomical importance, oblique plane provides unique perspective that standard planes may miss, especially for complex or curved structures. Talking about medical application, they are indispensable in advanced radiographic techniques such as spiral CT scans. Oblique slices may be used to view joints like the shoulder or hip joint or irregular body cavities. Now let's talk about their functional relevance or functional significance of anatomical plane. Each plane corresponds with specific type of body movement. For example, sagittal plane there is flexion and extension. In frontal plane there is abduction and adduction, and in transverse plane there is rotational movements. Now let's talk about clinical significance of anatomical planes. Clinicians rely on these planes for precision in diagnosing injuries, planning physical therapy, and conducting surgeries. For example, when describing a step wound or a tumor's location, doctor reference anatomical plane for clarity and consistency. Now let's talk about conclusion of this lecture video. Mastering anatomical plane is more than academic, it's vital skill for anyone entering healthcare or biology. These invisible lines bring order to the complexity of human body, enabling clear communication and precise medical care. Whether you are studying a skeleton or guiding a scalpel, anatomical planes provide